December seems like a long way off, but next year's federal employee health benefits plans are already coming into view. That's from the Office of Personnel Management's recent annual call letter to health insurance carriers. Federal News Network's Drew Friedman and I get some insight now from the editor of the Checkbook Guide to Health Plans for Federal Employees, Kevin Moss. Kevin, good to have you in studio.
Thanks, Tom. Nice to see you, Drew.
And just a quick question. This call letter that comes out every year, this is not like a dear colleague letter, you're in trouble, but it's more routine than that?
It's very routine. It comes out every spring, early spring or late winter every year, where OPM puts together their initiatives, what they want to see from health plans for the upcoming plan year, and if there are any new policies or new options that are now allowed by the FEHB plans. This is kind of the first notice to FEHB carriers on what those priorities will be for the upcoming plan year.
And last year's call letter to carriers from OPM, I know one of the big things there was about Medicare Part D. Are we seeing any similar size changes this year or anything with Medicare Part D that is changing for 2025?
Yes. So Part D was a huge story last year, and I think it's going to be even a bigger story this year. One of the details in this call letter, we start getting some indication of how the PSHB program is going to work. This is the Postal Service Health Benefits Program, which is launching for plan year 2025. So this upcoming open season will be the first year for postal employees and annuitants to enroll in new PSHB plans. One of the requirements for PSHB is that if you're an annuitant, that you receive Part D prescription drug coverage. So this is how postal annuitants will actually receive their prescription drug coverage. And every PSHB plan will have to have a Part D plan in order to provide that prescription drug coverage. Now, last year was the first year that these supplemental Part D plans were allowed by OPM. There were only 17 FEHB plans that offered a Part D plan. My expectation is, since many of the FEHB plans will offer PSHB plans, that Part D bundling that we're going to see in PSHB is also going to happen for FEHB. And so I expect almost every FEHB plan will have Part D prescription drug coverage available to annuitants this year.
Is that something that's going to be more of a benefit for participants then? Or what change does that really mean for those who are enrolled?
I think most federal annuitants and postal annuitants will benefit from Medicare Part D coverage. So one thing is, next year, the Part D law says that there's a $2,000 out-of-pocket limit for all prescription drug costs. So if you have anywhere from about $167 or more per month throughout the year, that adds up to above $2,000, obviously that catastrophic protection could save you quite a bit of money. OPM says that the coverage from these Part D plans should be as good or better, so that your out-of-pocket cost will be the same, or in some cases it might be slightly less. But there are a few situations that you still need to watch out for, that you still need to pay attention to make sure that you will benefit from this Part D coverage.
Does the fact that there is this out-of-pocket limit for these participants also mean that certain drugs that might be newer or certain drugs that are expensive will be left out of the plan? I mean, what kind of control do people have for, say, some of these emerging weight control types of drugs? Some of these things are expensive. They're kind of luxury drugs.
Yeah, well, Tom, you've actually hit on one of the big things that people need to pay attention to. OPM requires every FEHB plan to cover a GLP-1 weight loss drug. These are becoming very popular. They're getting more widely used. These are brand names like Ozempic and Wegovy that you may have heard of. Every FEHB plan has to cover at least one of those weight loss drugs. However, Medicare currently does not provide coverage of weight loss drugs. And the way this Part D plan works is that OPM allows the carriers to auto-enroll FEHB plan members with Medicare onto these Part D plans. So you will receive notice from your plan that you're auto-enrolled. And if you are currently taking one of these GLP-1 drugs from your FEHB plan, that Part D plan, as we sit here right now, is not going to be covered by Medicare, so you will lose access to that drug. Now, that's a very strong reason for you to opt out. And if you are in an FEHB plan and you get enrolled in a Part D plan, you have to be allowed to opt out. And losing access to the GLP-1 drugs would be one of the strongest reasons why you would want to opt out because, as you said, Tom, these are quite expensive if they're not covered by your health plan. We're talking about out-of-pocket costs anywhere from like $15,000 a year or maybe even more than that.
We're speaking with Kevin Moss. He's the editor of the Checkbook Guide to Health Plans for Federal Employees. And that's kind of a side issue because these drugs are not generally for people that want to lose 5 or 10 pounds. This is for the morbidly obese or people that have a deep-seated health problem because of their weight.
Yeah, I think that's right. I mean, a lot of them are prescribed for type 2 diabetes and sometimes prescribed off-label, like Ozempic, for example. It has FDA approval for type 2 diabetes, but many doctors are prescribing it off-label for weight loss. But as you say, it's mostly for the morbidly obese, not someone looking to lose 5 pounds for their beach trip.
What are these drugs for in the first place? What's the primary? I see endless ads for them, but what are they supposed to do? I mean, what's their primary use, just out of curiosity? Who knows?
I can't answer that one, Tom.
I'll have to turn the sound on for the ads one of these days to hear about them.
In the call letter to carriers from OPM, it mentioned at least some of the recent priorities they've had: gender-affirming services, maternal health, fertility benefits. Was there anything new in the call letter that spoke to some of those recent priorities from OPM?
So they mentioned that all those priorities still exist. And they quickly reference previous call letters or letters to carriers to remind carriers that all these things are still present. There is one new thing that I saw this year. OPM's committed to reducing and preventing opioid misuse. So they're encouraging carriers to offer non-pharmacological therapies and medications to treat pain. And all FEHB plans have to have one opioid rescue agent available without cost share. So it's a kind of a broader definition of preventative care and more education about the issue of opioid misuse.
That's the opioid equivalent of the EpiPen, you might say, to have that available.
Yeah.
Another part of the call letter references fraud, waste, and abuse that might exist in the FEHB program. There was a report from the Government Accountability Office in 2023 that showed that OPM might be spending up to $1 billion a year on ineligible participants in FEHB. Did OPM mention anything about why that is occurring or how they're planning to try to address that huge amount of money?
I think there's two ways that OPM is looking to control ineligible family members on FEHB plans. I think one, they're asking carriers to verify eligible family members. So if you add a family member, they're asking, the carrier to verify that new family member is actually an eligible family member. And then also with the creation of the Postal Service Health Benefits Program, OPM's building a central enrollment platform where they will be verifying both employees and annuitants and family members in a more centralized fashion, which should reduce the number of ineligible family members that are currently on FEHB plans.
Yeah, waste, fraud, and abuse is specifically called out in the call letter, so they're onto it, I guess.
Yeah, they definitely are.
And what about mental health services? I mean, that's something that they have been increasing emphasis on and an expanding coverage on. I guess gender-affirming types of work is also maybe under the mental health issue. Anything new coming beyond what they've added for the current year?
I think it's the same priorities that we've seen in previous years. Obviously, it's a very important issue, but OPM, to their credit, has been really early on making sure that FEHB plans are providing the coverage that federal employees and annuitants need for mental health.
And, we've talked about it a little bit already, but the Postal Service Health Benefits Plan, that's going to be something very huge this year and into next year. There's a special enrollment period coming up. Anything that was mentioned about that or, just the progress of that program as they're trying to stand it up?
Sure. A few things about Postal Service Health Benefits. One is that the Postal Service Reform Act specifies that year one, which is going to be this upcoming open season for plan year 2025, that if you are an FEHB plan that offers a PSHB plan, the benefits from that FEHB plan must be the same in that PSHB plan. So, for example, let's say it's Blue Cross Basic, which is a popular FEHB plan. If there is a Blue Cross Basic in PSHB, those benefits and cost shares are going to be the same year one. Of course, the rates are going to be different because the Postal Service employees and annuitants are going to be their new coverage entity away from all other federal employees and annuitants.